First, let's talk about two processes. Number one is preparing the uterus to allow the embryo, potential embryo, to implant. Those medications are pretty straightforward. It's designed to mimic a natural menstrual cycle. So, in a natural menstrual cycle, the first part of a woman's cycle, she makes a hormone called estrogen. What estrogen does, it builds up the lining of the uterus to allow for the embryo to implant. And then when she ovulates, she makes a hormone called progesterone. What progesterone does, it provides nutrition for the embryo to grow until the placenta takes over about 8 to 10 weeks. So when we're preparing a woman's uterus for the receive embryos after the eggs have been frozen, we want to give her these same natural medications that she makes in her body. We give her estrogen to build the lining of the uterus up. Estrogen can be given in pill form, patch form, or injectable form. And then once her lining is nice and thick, and the thickness depends upon the individual doctor, but typically anything over 7 millimeters is thick enough to allow an embryo to implant. Once we see that the embryo, the lining of the uterus is nice and thick, then she will start her progesterone. And the progesterone are either given in injectable form or vaginal capsules. Sometimes and very rarely you can use oral medication for the progesterone, but typically after you start the progesterone, the embryos are transferred 6 days after you start, 5 to 6 days after you start the progesterone, and then both the estrogen and progesterone are maintained for the first part of the pregnancy. Now, thawing the eggs is important to understand that there's a shell that surrounds the egg. It's called the zona pellucida, and that can get very thick. And the zona pellucida is very important because the sperm has to penetrate the zona pellucida in order to fertilize the egg. So a woman who's frozen her eggs and we're thawing the eggs out, that shell can be thickened, so the egg has to undergo a procedure called intracytoplasmic sperm injection, where we take one sperm, either partner sperm or donor sperm, and we inject that one sperm directly into the egg to bypass the hardening of the shell to get the egg to fertilize. Once that egg is fertilized, we let it develop to either to what's called the day three embryo stage, and is transferred to that stage, or the blastocyst stage, which is a day five or day six stage embryo, and then the embryo is transferred at that point in time. So the process of thawing and creating embryos are very straightforward. If you have a good quality egg that was frozen, you can pretty much predict about the survival rate is about 90%. Fertilization rates anywhere between 80 to 90% as well with the intracytoplasmic sperm injection technique. And then if you're younger, you have a very good chance of developing a blastocyst, a good quality embryo. Then pregnancy rates are, the randomized trials looking at pregnancy rates with frozen eggs are very good in young, healthy women. But as women get older, the pregnancy rates do decline because of the age that the egg was frozen. So the younger the egg is frozen, the better chance you have a successful pregnancy in the future.